Welcome back. Welcome back to the morning show here on Tobago Updates Television, and thank you so much for staying with us. We begin conversations this morning in studio by speaking with Ms. Shermin Joy Charles, Behavioral Services Officer, and Mr. Dionne Munday, Therapeutic Counselor of the Division of Health, Wellness and Social Protection. This month is Mental Health Awareness Month, and so this morning we'll be talking about substance use and mental health. Good morning and welcome.
Good morning. Thank you so much for having us this morning.
Of course, a pleasure being here with you in studio this morning and speaking on this very, very important topic. And I will start by saying that sometimes we take mental health for granted and we misuse the word to mean something that it's not. We attach a stigma to mental health. And so we notice that people don't really pay attention to their mental status. And so they don't seek help. They don't understand. Some things are not defined. There's a taboo.
Yes.
And so people, their needs just go unattended and then they escalate and things happen. And then now we have to deal with the outcome.
Yes.
And so it's very important to have conversations of this nature so we can understand what it really means to have a situation of a mental situation where you need attention. How do you know your triggers and those types of things, which we've had conversations about before.
Yes.
And so we want to connect substance use to mental health and what would drive somebody to decide, listen, I rather use a substance than go and ask somebody for help.
Yes.
Because as a coping mechanism, right? So let's talk through the topic and the relationship of the substance use and mental health.
So first of all, I want to define what a substance use disorder is. So a substance use disorder is when someone continues to use a substance even though they may be having some negative effects. So I can give some examples. So you might be smoking cigarettes and you realize that every time you smoke, you get a coughing fit. You can't breathe as much. But even though you're having these negative effects, you still feel the need to smoke. You may be someone who might be using alcohol, so you're always getting drunk. And your family members want nothing to do with you because you're always on the street, you're always drunk. You know this is a result of the alcohol use, but you're still using it. Or in a case where you may be using marijuana as a student, you realize as I'm smoking, I'm not able to concentrate, I'm not doing well in school, I'm not able to play the sports I would usually play. And even though you know that it's a direct result of the marijuana use, you still insist on using the marijuana. So that's where the substance use disorder comes in, where you continue to use it. You have this compulsive need to use a substance, even though it's negatively affecting you and also those persons who are closest to you.
And why do you feel, in your experience, especially in the field, people prefer or they resort to using a drug? Sometimes they might think it's recreational,
Yes.
and they resort to using this drug rather than talking to somebody. I know sometimes they think that men are macho and so they don't want to talk to nobody, and I rather drink a bottle of rum. And what are some of the things that lead people to that rather than having a conversation that is definitely needed?
I think when it comes to adults in particular, I think you mentioned it, the lack of coping skills. They prefer to use the substance because once it's a quick fix. So you may be stressed, you may be angry. You would hear a lot of persons would say, instead of going and stabbing somebody, let me smoke something and just relax. So it's a quick fix to deal with the situation. And we love things to happen at a quick pace. We love the immediate pleasure of things. And so we prefer to use these substances. In regards to children at school, it's a simple matter of they're at the stage where they want to experiment. So this is something new. Let me see what happens. They may be having a situation where they maybe feel pressured. They may feel a need to fit in. So that is why they will get involved in these substances. So it varies a lot. But I think what's most important is that persons don't have the necessary coping skills to deal with not just their regular challenges at home, but specifically their mental health challenges as well.
Okay, I don't know, either of you could jump in on this, but how prevalent in your work in Tobago here, how prevalent have you seen persons turn into substance use to deal with the matters?
I think it's increasing. We had a situation where when COVID happened, you realize a lot of persons were dealing with the loss of jobs. The children are home at school now, so you don't have the teacher to take them for that 8 hours. You have to deal with them 24/7. Persons losing income, persons like myself who just couldn't leave the country because I love to travel. And so you have all these stressors. And like I say, the easiest thing for you to do is really to just drink something to calm down. I remember during COVID, my father was ill. He ended up dying. And even I was one of those persons that realized that to just calm me down and deal with the grief, I would drink something. I would take an alcoholic beverage. And then after a while, it became something that I had to kind of get off of, because once I felt stressed, I would go towards the alcohol. So we're seeing a lot of situations where persons are using the substances to deal with those challenges.
So most persons, I don't want to make this a definitive statement,
Yeah.
but most persons most likely will not come to seek help with a counselor for their matters.
Yes.
What other types of coping mechanisms can they engage in that would be of more benefit to the individual than the substance use?
So the important thing is that we are trying to eradicate the stigma, and that's why we have education, so that persons can feel comfortable in a space and understand that everyone goes through something in life. And I always tell people that life is not always a bed of roses. You will encounter stress, and it's okay to acknowledge that you need support. You need assistance. A lot of times, persons, as you spoke before about males, a lot of times men would tend to seek out maybe the rum shop or the barber shop and think the barbershop conversation is sufficient, or having a drink would suffice. And they don't see the need for reaching out because they see it as a point of weakness, or a place of weakness. But actually, it's a strength. Having the ability and the emotional awareness to be able to reach out and say, well, I need that support. And that's why it's important that we encourage and foster an environment and build that community whereby persons can understand that reaching out for help is not something that is so taboo, as you would have said.
And I want to bounce off on what you're saying in terms of let's say there's somebody that somebody in your circle who is dealing with a situation or situations that are too much for them to handle. They turn to substances. How can that circle encourage this person? Listen, I mean, in as much as we can be here for you, you actually need the professional help. How do you encourage that person? Because in the back of their mind, they're still thinking, I don't need no help. Oh, I got you guys. I got the bottle of rum. I got my coping mechanisms, and I'm good for now. But sometimes we don't realize that things can escalate. They can get out of hand. They can be triggers that might cause you to go into.
Yes.
So how does the circle of people around them encourage them to go out and ensure they get that type of assistance they need?
I think that's the response right there. They need that continuous support. And once they have that continuous support before it actually escalates, because what we have to realize is that mental health is on a continuum. We all find ourselves along that line. So on one end of that continuum, you have good mental health, and on the extreme end, you have poor or failing mental health. And when they realize, and it so happens that a lot of times persons recognize that they are on the extreme end of that continuum, and that's when they recognize that they do need therapeutic intervention or even psychiatric intervention where it comes to medication. And even when they reach to that place, compliance with their medication and their therapeutic regimen is necessary. So building that support system is very vital for their recovery.
Do you think people with good mental health, do you think it is important for them also to understand both ends of the mental health? I can't remember what the term you
Continuum.
use. Continuum, that's the word.
Yes.
Do you think it's important for everybody to understand? Because somebody might be in good mental health, they're okay, everything is all right. So I don't really need to worry about that. Do you think it is important for everybody to know? This is what...
Because you have to, so I always tell people, know what your triggers are.
Yes.
Know what triggers you. Know what causes you to go over the edge. And always be able to recognize the signs in your body. So for example, if you know your elbow is hurting too much, you will visit a doctor, not so. If you think your eye is twitching too much or your hand is scratching where we might think it's money. But if you recognize strange things in your body, you will seek help. It's the same way if you recognize how much you have to be able to know how much you're able to take. What is your pain threshold, or what is your stress threshold? And when you identify that, then you are able to know, okay, before I move from good mental health all the way down to poor mental health on that continuum, let me seek further guidance.
You stated something earlier about family, friends, and community being there for you. But we also have a situation where persons often say nobody takes care of the carer.
Yes.
For the family that is supporting somebody with a substance problem, it could become very stressful.
It does.
How would you advise those persons to cope with the stresses of dealing with somebody with a mental health issue?
So I always tell them the same way that you would want help for your significant other, your family member, your friend, it's the same way you need to seek help. When we talk about substance use treatment, we don't just look at the individual. We look at the individual as a whole. Who is around them, how their family is affected. And we normally would involve them in the counseling situation because they would also need help on how to cope. We also advise them to not feel guilty because a lot of times persons can't blame themselves for their family member being in that situation. So we often tell them you need to not feel guilty, you need to not feel as though this is your fault. And as Mr. Munday would have said, you also need to know how much you can take. Because what happens, a lot of persons stay in these situations because they feel as though I have to stay there to help. But you also need to understand there are times when I may need to step away. We have situations where persons become enablers. So they protect these substance misusers. They try to excuse their behavior. They try to protect them. And in essence, you're enabling the behavior because you're sort of covering for them. So we always encourage them, you have to seek help for yourself. You have to stop blaming yourself and stop feeling guilty about the situation. And you have to ensure that your behaviors are not enabling the substance misusers' behavior.
You talk about persons knowing the stresses and that kind of thing. But the majority of persons in Tobago, in the country, they won't even realize that the mental health failing. They might just think, well, I'm under stress, I can just drink alcohol, that kind of thing. And we spoke about raising awareness earlier. But just tell us specifically, how has your unit been going around raising that awareness, getting persons to shift their mindset from just thinking of their mental health in a very casual way and taking it a lot more seriously?
Well, for the therapeutic counselors, we've been doing a lot of outreach, and we've been getting a significant amount of referrals from external service providers and stakeholders requesting our services to come out and chat with their staff. And we see throughout the length and breadth of Tobago, the island of Tobago, that persons are encountering challenges coping with stress, anxiety disorder, major depressive disorder, prolonged grief. And these are some of the more prominent challenges that we've been seeing emerging on the island as relates to ADAP.
Yes. So we do education. The Alcohol and Drug Abuse Prevention Program, we're focused on drug prevention education. So we go out and we educate persons on the issues surrounding substance use. We're looking at the effects, why you use, and we also look at them developing the life skills, the resistance skills, the coping skills to help them resist. And for those persons who are using, to help them stop their substance use. So that's what we're doing at the division.
We're getting some really, really good information here this morning, and we have to continue the conversation, but we have to go for a short break. Remember, you can leave your comments on our Facebook and our YouTube channel. We'd love to hear what you want to know as well. You can ask your questions and you can be a part of the conversation. But as we go, we invite you to help us.
Share the live, share the live, share the live.
We'll be right back. Welcome back. Welcome back to the morning show here on Tobago Updates Television, and thank you so much for staying with us. Before we continue conversations, we have the photo of the day. Can you guess where this photo was taken? This is right here in beautiful Tobago, and we want to say thank you to Lawrence James for sending in this photo today. Remember, we will reveal the answer to you at the end of the segment, but you have the opportunity to leave your response in our Facebook and YouTube live stream comments. Beautiful, beautiful Tobago, I tell you. All right, ladies and gentlemen, we continue conversations this morning. We're speaking with Ms. Shermin Joy Charles and Mr. Dionne Munday. They're both representatives of the Division of Health, Wellness and Social Protection as we continue to celebrate Mental Health Awareness Month. Before we went to the break, we were talking about public awareness in terms of ensuring people understand what mental health is, what their triggers are, when they should seek help. And my question is, at what age? Because we're talking about your visiting offices and, we're talking about all the different services that you provide. But let's be realistic and bring it into a real life scenario. At what age should somebody really start having a conversation about my mental status? When is a good time to start identifying triggers and knowing that I can talk to somebody, reach out to somebody? What kind of age group we're looking at?
So that speaks to building emotion, what we call emotional intelligence. And we often recommend at the age of preschool, so emotional intelligence is really and truly the ability to recognize, understand, regulate your emotions and know how to use them in specific areas. And we say starting at the preschool age because you're trying to build and cultivate that level of emotional intelligence from a child. And as they grow, they develop these skills. So they learn social skills. They learn how to navigate the world around them. They learn how to manage their emotions, learn problem-solving skills, coping mechanisms, and so on. And as they grow and develop and they become more emotionally aware, they learn how to critique themselves and how to do introspection. And it's only when you're able to do that, as we spoke before earlier, in terms of recognizing your triggers and understanding your triggers and then developing healthy coping mechanisms. So, people use unhealthy coping mechanisms such as substances and other forms of activities, but we try to push and emphasize, yes, it's a feel-good moment. In the moment, you feel okay, but what is the end results? So that's why we try to encourage persons to build healthy coping mechanisms so that it benefits them and those that are around them.
And I'm happy that you introduced healthy coping mechanisms because we always refer to the unhealthy ones.
Yes.
And what are some of the healthy ones that you can recommend that people can consider that they engage in to get themselves back in a good place, at least a place good enough to seek help? Because, you mentioned that the coping mechanisms are only temporary. Some of them which are good can stick. Like going for a walk could be a good coping mechanism. I've seen some people use that and they've actually lost weight and they feel better and they're good. But some of them don't follow through. So they will still need the professional help. So what are some of the healthy coping mechanisms that people can engage in?
Right. So we encourage persons to do a lot of journaling. That's very important. Yes. Get your emotions out. Exercise is very healthy and very useful as well. Seeking support from family and friends, it's very important as well. We invite persons to engage in mindfulness activities, breathing exercises, what we call in the field of psychology, learning how to challenge your negative thoughts. So a lot of times behavior is preceded by an emotion, which is preceded by a thought. So we oftentimes tell persons, once you begin to have control over your thoughts, then you will evidently have control over your feelings and emotions, and then evidently your behavior. So it's important that you learn to see the positive things throughout the course of the day. So we engage persons. So one of the activities I work with my clients is a positive journal. What can you get out of today that was positive? Because a lot of times our mind tends to focus on the negative things, and we try to highlight the positive things that is happening in our lives. The simplest thing, someone opening a car door for you, someone stopping a car for you to cross the street. It's positive. And when you're able to see that, you have a different perspective on life.
Absolutely. And some of those things you kind of take for granted, somebody stopping for you to cross the street, you think you were supposed to stop.
Yeah, even
But
if
actually,
I say
it's an act of
thanks.
kindness. Yeah,
Yeah.
that's right. It's an act of kindness that you really can use to cheer yourself up and to see your self-worth. And I endorse journaling, viewers. I endorse journaling because I have seen the benefits of journaling. And I mentioned before you all came on air that I work with a group of young people. And one of the things I encourage them, journal.
Yes.
Every experience you have, journal it, because that group of people, the young people, they be going through it. They are going through it. So I encourage them to journal, good and bad, and to weigh the pros and the cons. What could I have done better? What worked out for me? What are the things I can do? So I really endorse that, and I really want to encourage our viewers this morning, to pay attention to the things around you and the things that alter your behavior, and what is the reason that cause your behavior to be altered. As Mr. Munday said, he said, when you get to master your thoughts, and it might sound difficult, it might sound difficult. So our viewers want to know, how am I going to be mastering my thoughts to ensure my behavior change?
When it comes with practice. So I oftentimes use the example. If you want the ideal weight, you go to the gym consistently. Not so?
Yes.
Right. And then when you achieve that goal, you will have to maintain it. So I oftentimes tell persons, let's picture yourself at the gym. You will go to the gym for 6 to 8 months just to fix carnival. But after carnival, what happens? You still want to be able to maintain a healthy lifestyle. And it's so doing the same way for your mental health. It's all about ensuring that you commit to the process. And after you have achieved good mental health, you work on actually maintaining that.
Yes.
Mr. Munday, we spoke earlier about younger persons coping with the stresses of life and the environments that they're in. And we know a lot of young people, a lot of children and teenagers, they live in very stressful home environments. In terms of those kinds of individuals, how do coping mechanisms work for them? Because you might give them a coping mechanism and they have no choice because they are minors.
Yes.
They can't really remove themselves from the environment. They have to live in the environment. It might be an abusive environment, or it might just be an environment where the child cannot live like a child. Some children have to live like adults because they have to help their parents, and that really impacts on their mental health as well. How, in your experience, how successful has coping mechanisms been in helping those persons?
Well, I think it goes back to involving the entire family, as we spoke about community and family. And what I would usually do in terms of when I'm working with children or minors, now they're minors, so of course they have to access our services through a parent or guardian. And I always encourage parents to be a part of the conversation and invite them into sessions from time to time to give them feedback. And not just only feedback, but I give them homework. So I give the parents activities to do as well to help address some of the challenges. Because the reason that these parents would have sought out help is the fact that their child is acting in a way that is not in the norm, within the norm, and they're concerned. And I use that as an example. I say, you're concerned. So therefore, the advice and the counsel that you are receiving now, put it into practice. And I use that as an opportunity to get into the family. And sometimes you may have to do not just intervention with the child alone, but with the parents and the family in general.
But in cases where, let's say, the parent hasn't reached out, it's the child that is reaching out. What is the legal situation? Can the child access counseling without the permission of the parent?
No. So we have to be very mindful of that. Children cannot. And in the past, we've had young persons reaching out to us through our hotline, and we would have had to take a stand and indicate that we are guided by certain policies and principles and guidelines that govern the state of our land as well. And they must reach out with a parent.
Is it possible? I think I understand what you're saying, because it really is challenging for a person who is not an adult to seek help if they really need it. Say, mommy has to come with me or daddy, and they are the reason why I'm actually seeking help. So I understand the challenge there. But is it possible? Because I know, of course, there are agencies who work together, you collaborate, and of course you have that relationship. In terms of the setting, the school setting, like student support services, is it possible for an officer or a guidance officer to make a connection and make a recommendation for the child to be referred?
Correct. So children can speak to their guidance officers, their school social workers, or their school psychologist, and they in turn will do an assessment to determine the needs of the child. From then, they would make connection with the parents. And from then, if they need to outsource further therapeutic intervention, that's when they reach out to us at the division.
So it really still depends on the parent. It goes back to the parents.
It goes back to the parents.
So is there, I know this might be way beyond you, but is there a need for some sort of legal amendments to allow children to access mental health without their parents? Because sometimes, like my co-host said, the parents are the cause of the mental health breakdowns, the challenges that the child is feeling, and those types of parents, those types of adults may not be very open to that kind of intervention, but the child is desperate for it.
Well, the only thing I can think about is the Children's Authority.
Yeah.
If the child determines that they're in a space where it's toxic, it's abusive, then they have no choice but to reach out to the Children's Authority of Trinidad and Tobago, and they will get support from there. They are the only body that will be able to do that level of intervention without that parental. Yeah.
Okay.
As challenging as it is, I am still happy that there are outlets.
Yes.
And there are resources that we can use, young and old, that we can, reach out to and ensure that we get the measure of help we want. And I want to focus back to the Division of Health, Wellness and Social Protection in terms of what type of assistance or services you provide because we spoke about substance use disorder for that, and also for general mental health.
So I will talk about the substance use disorders. So what we offer at the division is we have outpatient treatment services. That's basically you come in for counseling maybe once or twice a week, depending on the severity of your substance use, and then you go back home. Right now, we don't have an inpatient facility, but we do have links with inpatient facilities in Trinidad. So if we see that there is a need that you need to be referred to them, then we can make that referral and make that linkage as well. And I know that the mental health unit at the Tobago Regional Health Authority, they also have a substance use clinic where persons who may need a more clinical treatment can also access treatment there.
So as it relates for therapeutic intervention at the therapeutic counseling unit, we do in-house counseling, but we also do referrals to the Child and Adolescent Center. We also do referrals to the mental health clinic. So what happens is we have persons that will present with, as we're on the topic of substance, persons who may present with what we call substance-induced psychotic disorder or psychosis, substance-induced bipolar disorder, and substance-induced depressive disorder. Now, because these disorders are due to the fact of substance, and because of the nature and the symptomology, you may have to seek treatment elsewhere to bring those symptoms to a place where talk therapy will be able to be useful. Yes. Because when you get a substance-induced psychotic disorder, you talk about hallucinations and delusions and persons who are not grounded in reality. So talk therapy is not going to work if I'm speaking with someone who is not grounded in reality. So therefore we outsource and we would refer to the substance use clinic at the mental health clinic in the Scarborough General Hospital, and we do other referrals. Sometimes we have clients that come in from the school services, and once they are within the schools and the guidance officers are able to work with them, we can do referrals back to guidance officers as well.
Yes, it is a lot. It is indeed a lot. But I'm very, very thankful that the services are there. And if persons wanted to contact you, how can they reach you?
So for us, we have the counseling support hotline. That is 683-8341. You can reach out to a therapist between the hours of 8 a.m. and 4 p.m. Monday to Friday. And someone will take your information, do a referral, and then you will be referred subsequently to a therapist. So that's one way. They can come into the division, come up to the 4th floor. So we are located at number 7 Montessori Drive in Glen Road. You come up to the 4th floor. You just let the security know you're here to do a referral, and we'll take it from there.
And at ADAP, we're at the same building. They're on the 4th floor, we're on the ground floor. And you can contact us at 487-6665 between the hours of 8 to 4 p.m., 487-6665.
Thank you guys so much for coming this morning and sharing this very, very, very important information with our viewers. Viewers, there is help. You are not alone. You are not alone. There is help, and you can reach out for help. Let us break the stigma of thinking that we don't need support with our mental status, because we do. The simplest of things can escalate into something that is overwhelming that you might not be able to manage. So keep your circle tight and close. And also, if they tell you, sis, you need some help, reach out for help. And you can get that at the Division of Health, Wellness and Social Protection. We've been speaking with Ms. Shermin Joy Charles and Mr. Dionne Munday of the Division of Health, Wellness and Social Protection as we continue to celebrate and bring information and awareness to Mental Health Awareness Month. We have to go for a short break before we continue conversations, and as we go, we invite you to help us.
Share the live, share the live, share the live.